Good afternoon. I'm Greg Cox, Chairman of the San Diego County Board of Supervisors, and we're here today to announce some major developments in the ongoing coronavirus or COVID-19 situation here in the county. The County of San Diego has been committed to addressing this emerging health crisis with local partners. In fact, we just got out of a meeting with a lot of the local mayors who you see standing behind me here today to discuss how we're going to implement local actions to stop the spread of this virus. I want to take a moment to acknowledge the mayors and some of the other officials that are here today standing behind me, starting with Assemblymember Todd Gloria, Sheriff Bill Gore. We have Richard Bailey, the mayor of Coronado, Mary Salas, the mayor of Chula Vista, Bill Wells, the mayor of El Cajon, Steve Voss, the mayor of Poway, Rebecca Jones, the mayor of San Marcos, Alejandro Sotelo Solis, the mayor of National City, and of course Kevin Faulkner, the mayor of the city of San Diego, who will be speaking towards the end of this conference. We also have Scott Chadwick, who is the city manager of the city of Carlsbad, representing Mayor Matt Hall. Cindy Martin, the superintendent of the San Diego Unified School District, I believe is going to be here if there's any questions regarding schools. And we have Commander Eduardo Cua, who is the Deputy Federal Health Coordinator for the Federal Health Agency. Obviously, we're here because of a very important issue. Just a week ago, we provided information on the status of this virus. But as you can imagine, the situation changes literally by the hour, and we've received new information and guidelines from the Center for Disease Control and state officials. I do want to say one thing. I know that people out there are nervous, and even scary times like this means that we all have to be ever vigilant, and we need to be reassuring. And that's one of the things we want to do today, is to reassure the citizens of San Diego County that we have a united effort on the part of the County of San Diego and all the cities in this region and all the public health officials to address this issue in the most responsible and straightforward way. We're working with federal health experts to determine the best course of action to help stop the spread of this virus. We've got a lot of hardworking employees throughout the county, throughout the region, healthcare professionals that are all working together as a team, literally night and day on this issue. And I want to thank Dr. Wilma Wooten and her staff and all the county employees for their tireless efforts to safeguard the public's health. This is an emergency, there's no question about that. But San Diego has faced tough times before, whether they're the fires or the H1N1 crisis a few years ago. We've gotten through those issues in a very orderly manner, and we've taken care of the situation. This is not going to be any different. If we're all smart about this problem and maintain our cool, we will certainly get through this issue also. This past week, the Board of Supervisors took action to create a subcommittee to work on this issue with our healthcare professionals, comprised of myself and Supervisor Nathan Fletcher, and to lead and provide updates like what we're doing here today. So with that, I'd like to introduce Supervisor Nathan Fletcher.
Thank you, sir. Thank you, Chairman Cox, and a special thank you to all of the public officials who are joining us here today. You know, in January, when we started addressing this issue, we did it out of an abundance of caution. We also did it out of the understanding that the situation, the severity of it, was likely to increase. In February, when we were one of the first local jurisdictions, counties, to declare a public health emergency, we did so out of an abundance of caution, but also with an understanding that based on global trends, the unique nature of COVID-19, that the situation we faced was also likely to increase in severity. And we're standing here today to provide an update on the increased severity and the increased course of actions that we are going to take. I do think it is important to note that in San Diego, this is not a partisan issue. This is not a jurisdictional issue. This is not a this group versus that group. What you see represented here today is all sectors and all aspects of our community standing together to speak with one voice, because the challenges that impact our community impact all aspects of our community. And I think that the residents of San Diego should be heartened to know that every possible step is being taken, that we are being collaborative, we are being progressive, we are being aggressive, we are being transparent, and we are doing everything that we can here today. The reality is the resolve of our community is stronger than the strength of any virus. And the actions that we've taken so far and continue to take are all designed to protect the public health of the residents of San Diego County. We have a number of important updates to address on new positive test cases, new public health orders, new advisories and guidance, along with statistical updates on specific steps that we're taking. And we ask for your patience as we walk through all of these issues, and also your understanding that the situation we're encountering is a very dynamic one. It is a very fluid situation. It is something that literally changes hour by hour and day, and we will continue to provide regular updates. I'm going to walk through 5 areas of importance that we want to update you on, and then our public health doctors and experts are going to provide more information and more expertise around each of those areas, and we will also have an opportunity for questions and answers. First, an update on the number of new cases. Today, we have multiple new positive cases of COVID-19 to report. Dr. Wilma Wooten will walk through these cases, sharing as much information as she can, but we now have 5 new positive cases, in addition to the 1 positive case that we reported last week. With these new positive cases, the evidence is pointing to the very likely reality that we now have community spread in San Diego County. This changes both our posture, this also accelerates our action, and we are moving forward with the assumption and operating under the premise that we do have community spread. Now, a lot of the things that we're going to talk about are designed to try and flatten the curve. When you see a lot of jurisdictions that have experienced significant challenges, you see a huge spike in infections and hospitalizations. We are taking action to try and lower that, to lower the curve, to slow down the rates of infection, to slow down the rates of new cases. And we are doing that not only to protect the public health, but we're doing that to protect our healthcare system. We want to desperately avoid any overtaxing or overwhelming of our public health system. And so all of the things that we are announcing today are designed to do that, to try and lessen the severity, lessen the rapid acceleration, and make sure that we have all of the health services possible available for our residents who need them. So with that, 3, we're issuing a public health order today. Last night, the governor of California issued an executive order to limit mass gatherings of 250 people or more throughout California. In the county of San Diego, we're issuing a public health order that effective midnight tonight, any mass gathering of 250 people or more is banned in the county of San Diego. This includes all jurisdictions throughout the county of San Diego. This legally enforceable order is in effect for now through the end of March. Those gatherings that are under 250, we are strongly encouraging them to ensure the social distancing spacing requirement of 6 feet before each individual. And while this is a legally enforceable action, we are asking for the public's help. We are asking for the public's cooperation to help us ensure that these mass gatherings are not taking place, to help us ensure that we are avoiding environments where, given the unique nature of how rapidly this virus can spread, that it has the potential to spread to the greatest number of folks. The simple fact is this virus is highly contagious. We know that it is currently spreading throughout San Diego County, and we need everyone to come together to take action to try and limit that spread. This step, while inconvenient, is an established best practice, consistent with federal guidance, with state guidance, and with full support of our local public health experts based on the situation that we face here on the ground in San Diego. A part of our public health order today also includes specific directives to our hospitals and healthcare facilities. We are directing them to limit non-essential personnel from coming in or out of healthcare facilities. We are also providing specific guidance around how they should treat essential personnel who may experience symptoms. Maintaining the health of our healthcare system is of vital importance, and protecting the vital workforce in that healthcare system is a key point of our ability to effectively address and confront this situation. In addition to the official public health order, we are issuing a new advisory. We are advising, strongly encouraging and advising all senior citizens age 65 or older, along with any person, regardless of age, who has a chronic illness, to cancel non-essential travel, to prioritize staying at home, and to avoid large crowds or mass gatherings of any amount. We know that this virus is particularly impactful for our senior citizens and for those with underlying chronic health conditions, and we are asking those individuals to go above and beyond the established public health advisories on what we want things to do. Now, the risk to generally healthy younger folks remains very low. The primary risk for those folks is the spread to those vulnerable populations. And so we are trying to target those vulnerable populations to have a positive impact. All of the existing public health advisories remain in effect. Wash your hands, stay home if you're sick, cover your cough or sneeze, practice good health habits. And we want to reiterate to the public how important those are, because those are the steps each and every one of us can choose to take in our own daily action, not only to protect ourselves, but to protect our loved ones who we might be at risk of spreading it for. Today, we're also going to provide a number of updates. Dr. Wooten will provide updates on our testing capacity, on our testing protocols, along with the steps we are taking to try and be innovative, to try and expand that, to provide more opportunities. We're providing an update today on the situation with Miramar. This is the repatriation of the individuals from the Princess Cruise Line. On Tuesday, we received 42 individuals who were flown into Miramar. Yesterday, we had 2 flights, and we have arrived 235 additional individuals. We are expecting another flight today, perhaps as we're speaking. Our current estimates are that there will be around 400 individuals repatriated from the Princess Cruise Line here into San Diego County. And as a county, we're going to shoulder our share of the load, perhaps more than our share of the load, to protect Californians and those who are in need of help and assistance. And we will do that in coordination with the military officials and with the state of California. Yesterday, we talked a lot about the hand washing stations, and I want to update you because this is vitally important for protecting vulnerable communities. As of right now, the County of San Diego has installed and funded 114 hand washing stations throughout the county, including the unincorporated portions and communities. We have an additional 54 that are in process of being deployed to MTS, to transit centers and riderships. We expect all of that will be completed this weekend. 10 jurisdictions, including MTS, have made requests for installations, and we are fulfilling each and every single request we receive. We expect more jurisdictions to make additional requests, and as we get those, we will fulfill those as well. Additionally, we have a challenge with individuals who might be a person under investigation or might have a positive test who do not have a home or a location to go self-quarantine or self-isolate. This is particularly acute perhaps with individuals from the Princess Cruise Line, a senior who might be in a senior living center who is a person under investigation or a positive test. We don't want them to stay there. They have nowhere else to go. Or it is particularly acute for our homeless and unsheltered individuals. As of right now, the County of San Diego has secured 90 motel rooms that are appropriate and available to house and shelter these individuals, along with providing the care that they need to deal with the situation. And although we are at 90 right now, we are in active negotiation and participation to expand this number. We're looking at a variety of options because what we don't want is individuals to automatically go to the hospital. Unless you need to go to the hospital, we do not want you to occupy the critical space that we need in our healthcare system. And so we're moving to have options available for those individuals. And then finally, we're continuing to work with all of our 8 focus groups that we have talked about throughout the process of this. We've added a new one to our focus and targeted areas, and that is our jails and correctional facilities. The sheriff is here, and they are moving to implement procedures and protocols to make sure that we are protecting individuals in those. We continue to engage with the business community, both with the issues of helping facilitate individuals not being forced to make a choice of do I have to go to work sick or pay the rent. I know that there is a lot of discussions, and I have great concern about the status of workers, particularly low-wage workers, the availability of unemployment insurance, the availability of supplemental pay, and I think we take seriously the obligation and charge to make sure that a health issue does not turn into an economic justice issue and is exasperated because of that. We're working with the schools. Cindy Martin is here to talk about that. Another targeted group are assisted living and skilled nursing facilities. Again, a high-risk, high-vulnerable population. We're in regular daily contact and engagement with those. We're also briefing regularly all of the regional government officials and agencies on all of the steps, along with answering any questions and addressing their issues. At the conclusion of this event today, we will be doing a conference call with all of these individuals. Healthcare efforts continue daily, military efforts continue daily, and our programs around the homeless also continue daily. So as a county, we are working in coordination with the cities, with our healthcare partners, with all of these individuals to make sure that we come together and do everything possible. In a minute, you're going to hear from our public health experts and workers, and I just want to take a second to pay tribute and particular thanks to our public health leaders. These are individuals who dedicate their entire life to protecting the public health. The situation we're confronting now are the situations that Dr. Wuma, Dr. Infantidis, Dr. McDonald, and everyone who works for them trains and prepares for every single day. In the County of San Diego, we believe in public health, we believe in protecting it, and we have great confidence in our public health workers, from the top leadership you hear from daily, all the way down to the public health nurses who are out there every single day doing heroic work to try and tackle the public. And we're very grateful for what they do, and we take seriously their information, their charge, and their guidance. And our county is stronger because of their strength. So thank you all very much for working through that. And now I believe we're going to bring up Dr. Wooten to provide more information and context for each of these issues. Dr. Wooten.
Can everyone hear me? Well, thank you, Supervisor Fletcher. What a difference a day makes. In the past 24 hours, monumental events have occurred that will impact what we are announcing here today to protect public health and slow the rate of the transmission of COVID-19. First, the World Health Organization announced yesterday that they have declared a global pandemic for COVID-19. Second, the state issued a directive regarding mass gatherings. Third, Miramar was selected to receive California residents for federal quarantine from the Grand Princess cruise ship. And fourth and last, the county is reporting 5 new presumptive positive COVID-19 cases. 4 of these cases were identified through testing at our county public health laboratory, and 1 case through local hospital testing capacity. Now, as with our first presumptive case, we will not be giving detailed information about these cases to protect the confidentiality of the cases. Case number 2 is an adult female in her 70s. The case and contact investigation process is underway with this case. The individual was reported to the county from CDC due to travel on the Diamond Princess cruise ship. She is at home on home isolation. Case number 3 is a male in his 50s with a history of travel to Colorado, and this investigation is in process. Case number 4 is a male in his 40s rather, and this individual may have a travel history to Colorado, but the investigation is in process, and the person is on home isolation. Case number 5 is a woman in her 70s who was in federal quarantine at Miramar from the first plane that presented there 2 days ago. The woman also was on the Grand Princess cruise ship and is in the hospital on hospital isolation. Lastly, case number 6 is a male in his 50s and is hospitalized in isolation. And this may likely be a community transmission case, but again, the investigation is ongoing. As of yet, we do not have a history of travel. So we fully expect and know that we will get more cases, and yes, we will have deaths. Regarding individuals on federal quarantine at the Miramar, at the Marine Corps Air Station at Miramar, there are approximately 433 individuals that have arrived on flights. And as Supervisor Fletcher stated, 1 flight is arriving as we speak. Management of these individuals will be done in the same way as we did with support to the federal and state governments. This process will look very similar to the February situation of repatriated citizens from Wuhan, China, housed at Miramar. There continues to be questions about testing capacity for the county. Currently, there are 3 categories, and these tests are performed first by the County of San Diego Public Health Laboratory. We currently have 2 test kits that can test 600 patients each. So we currently have a capacity of testing for about 1,200 individuals. Overall, the county has received over 300 specimens, with over 100 of these specimens performed at our county public health laboratory, and the others were sent to CDC before we had the capacity to test. Commercial laboratories, including LabCorp and Quest, are coming on board, as are local hospitals that are also developing the capability to provide COVID-19 testing. More of these entities will soon be onboarded to support testing countywide and even statewide and nationwide. As mentioned this morning, Governor Gavin Newsom issued a directive that updated the state health department's policy on mass gathering. Such events should be postponed or canceled statewide in all 61 public health jurisdictions to slow the spread of COVID-19. Gatherings should be postponed or canceled across the state of California for at least the remainder of the month of March. And that policy or directive will be re-examined at the end of the month and may be extended as needed. Non-essential gatherings must be limited to no more than 249 individuals, because the criteria is 250 or more should not gather. While smaller events can proceed only if the organizers can implement social distancing, which means, and we failed that right here today, but which means that we will have 6 feet between individuals. Gatherings of individuals who are at higher risk for severe illness from COVID-19 should be limited to no more than 10 individuals, while also following the social distancing guideline of 6 feet. Dr. Ifantides will speak more about vulnerable populations later. The state's updated policy defines a gathering as any event or convening that brings together people in a single room or a single space at the same time, such as an auditorium, a stadium, an arena, large conference rooms, meeting halls, cafeterias, or any other indoor or outdoor space. To further support this directive, today in San Diego County, I am announcing that as health officer, I am issuing a health officer order to ban mass gatherings as defined by the state. Given the action of the World Health Organization to declare COVID-19 a global pandemic, the swift action to ban mass gatherings is one of several social distancing strategies that can be used to slow the spread of COVID-19 pandemic, just as Supervisor Fletcher talked about decreasing that curve so we do not overcome our healthcare system. Now I would like to welcome Dr. Ifantides to the mic.
Thank you so much, Dr. Wooten, and I would like to now unpack with a little bit more detail the second part of the directive that Dr. Wooten is given today. In addition to the ban on large gatherings, there are now additional directives that we are also giving for specialized healthcare settings that serve high-risk patient populations. This includes our acute care hospitals that provide inpatient care, and all of the regional long-term care facilities in San Diego County, including skilled nursing facilities. We are directing all such facilities to implement immediate, aggressive visitor restrictions and to enforce their sick leave policies for all of their employees who may be ill even before COVID-19 is formally confirmed to be present either in the facility or in the surrounding community. While these actions are very proactive, they are done with love for our community. As health stewards of this region, we need to protect your health and well-being, and as has already been mentioned, to ensure appropriate and indicated utilization of our acute, primary, and urgent care facilities. We at the county have been and will continue to remain in a position of vigilance, driven by data-informed guidance and decision-making. We are now constantly monitoring and assessing and strategizing if future actions of this magnitude will be necessary. As has already been said, and it is worth repeating, we do expect that there will be additional cases of community-based transmission of COVID-19 in the coming days. As was also referenced, furthermore, I would like to now provide some specific and what I believe is compassionate guidance to a couple very important segments of our community. Seniors who are over the age of 65 and all individuals independent of their age who have underlying active and chronic medical conditions, they are unfortunately at risk for more serious complications of COVID-19 infection. As such, as has been stated, but bears repeating, we are strongly recommending that they cancel all non-essential travel, that they prioritize staying in the comfort and security of their own homes, and they do everything they can to avoid large crowds where they could be at further risk. I would like to now invite back to the microphone Chairman Cox, who will make another introduction, and then shortly I will be back to facilitate answering some of your questions. Chairman Cox.
Somebody that I neglected to introduce, standing behind me here is our fellow supervisor Diane Jacob, and we want to acknowledge Cindy Martin, the superintendent of the San Diego Unified School District, is here in case there are questions regarding the schools. It's my pleasure at this time to, as you look behind us, I mean, this is amazing to see the entire region to come together. Obviously, we have mayors, we have representatives from the business community, from the military, and a lot of healthcare professionals. We really look at this as a regional problem, and we're very proud to have representation from all parts of the region today, with mayors standing behind me. And to speak on behalf of those mayors, I'd like to introduce the mayor of San Diego, Kevin Faulkner.
Thank you, Greg. Thank you, Supervisor. Just a few words, and to reiterate what supervisors just said, we are all in this together, the entire region. Obviously, across the nation, organizations of all sizes and cities are taking steps to prepare for an influx of cases. Here in San Diego, we are, of course, doing the same. We must be vigilant. We must be vigilant to protect against further spread of COVID-19. And that's what today and these actions are all about. In abundance of caution, I am issuing a state of emergency for the city of San Diego, effective today. This follows, of course, the state of emergency issued by the County of San Diego, as well as the declaration issued yesterday by the World Health Organization, which officially labeled COVID-19 as a worldwide pandemic. This action is a procedural action to ensure that us at the city can act swiftly without any unnecessary restrictions should our status change. And simply put, this declaration allows us to respond to situations as they arrived and to respond quickly. It authorizes us to issue emergency contracts, if necessary, to carry out city business, and most importantly, to combat the spread of the virus. And it allows, of course, the city to seek reimbursements for costs accrued during this emergency if they are offered by the state and federal government in the future. I appreciate the partnership with Council President Georgette Gomez, who we have continued to be in contact with, and I appreciate, as I said, her partnership. Additionally, the City of San Diego is making preparations for all of our city employees, all of our internal operations, with a clear focus on ensuring that core city services continue as usual. We are also operating, as Dr. Nick just said, and many of you were here when we were here yesterday, operating on high alert when it comes to our most vulnerable population of those that are homeless. We continue to work very closely with the county and the San Diego Regional Task Force and the Homeless Project to make sure that those that are living on our streets, those that are living in our bridge shelters, to make sure we have every possible effort to ensure this virus does not take hold among this population. And again, I commend all of our county health officials, the public health nurses that are being a part of not only this education but outreach and indeed screening at our bridge shelters. A couple of other things before I turn it back to Dr. Nick. San Diegans should remain calm. We should remain diligent. We should continue, and we're going to keep reinforcing this, to practice proper hygiene and hand washing and sanitation. We're going to say that over and over and over. It's incredibly important. Stay home if you feel ill. And of course, continue to monitor the county's website for the latest updates. Finally, as was mentioned earlier, we received clear direction from the state and the county, which restricts the gatherings of large 250 at least through the end of the month. This action, of course, calls for agencies to cease permitting these non-essential events that will draw this amount of people. And of course, as we just heard, it calls for seniors and persons with compromised immune systems, which can suffer greatly from this virus, to limit their interaction with others. City staff at the City of San Diego have already begun reaching out to permittees of large events that are taking place this month to ensure that they heed the state and county order. Look, we know that these changes, they're going to have a real impact on San Diegans and how we live our daily lives for a bit. But I want you to know that even though we know that this is affecting our economy, our jobs, and our loved ones, we know it's neither convenient nor easy to operate in times of uncertainty. But we're going to. We're going to. All of the cities, all of the counties, united in working together. We can control how we respond to this challenge. And that is what this afternoon is all about. So I want all San Diegans to know one simple thing. We will continue to operate based on the facts. Based on the facts. Because the health and safety of all San Diegans is our top priority. And everyone in every city throughout San Diego County. Lastly, city and the county are in lockstep and will continue to provide these updates as this issue continues to develop. I want to thank all of my fellow mayors that are here. So you heard from our supervisors and our public health professionals. It's about collaboration. It's about sharing information. And I think most importantly, it's about taking proactive action with one goal. We're going to help people and we're going to save lives. This is a team effort. This is a coordinated effort. It is absolutely imperative that we work through this as one region. One region. And we will continue to put the safety of all of our residents first and foremost. With that, I'm happy to turn it back to Dr. Nick, who will answer any specific questions.
Thank you so much, Mayor, and I just again want to reiterate what a blessing it is to us to have this opportunity to stand in unity with all of you as civic and political leaders for the harmony that situations like this demand between science, politics, and civic leadership. As we have been doing regularly recently, I am going to now open the floor and field some questions. We have covered a tremendous amount of ground today, In the interest of both stewardship of time and succinctness, I would ask that you raise your hands. I will call upon you. You will introduce yourselves, please, and succinctly ask your question. I may be the one that will answer many of them, but will also be in a position of doing question triage to the many folks who are standing here with me. I also want to say again ahead of time, as Dr. Wooten says, there are probably questions that some of you are going to ask that are pretty specific, that in the context of both respect for privacy as well as the reality that there are many things that are ongoing in terms of investigation, our inability to answer some of those questions fully is nothing but appropriate and not in any way a compromise of our desire for optimal regional transparency. And with that, I will open the floor to questions.
Paul Sisson with the UT. Did any of the 6 folks who were presumptive positive visit any public events?
The question is with regard to any of the 5 folks that we just announced that are presumptive positive, if any of them attended public events. Many of these test results are just recently received. The contact tracing and investigation is ongoing. As Dr. Wooten said, there is one of the cases where the indication is in most likelihood that it is a community-based transmission. So Paul, at this point in time, that is the extent of what I can say. Yes, sir.
I want to ask you about testing. I had a 70-year-old retired RN go to Sharp's urgent care up here. She had a fever, she had respiratory problems, coughing, and a history of asthma. She was given a nose sample, and the doctor wanted it tested for COVID-19. She was called back that same day and told she did not qualify for testing because she was not in the hospital and she didn't have pneumonia. She was ambulatory.
Okay.
So my question generally is, what is the criteria for getting tested? And if people want to get tested, how do they get tested?
A very thoughtful and complicated question with regard to testing. And let me, as quickly as I can, both respond and again use this as an opportunity to both do some level setting as well as education to our general community. As Dr. Wooten just mentioned, we have 3 alternative routes for testing. The testing that is occurring in the public health laboratory is one that we are still following CDC guidance, though that has loosened recently, to ensure appropriate utilization of those tests. The tests that are occurring in the commercial and some of the health systems that have started doing testing, the county officials are no longer involved in authorizing those tests, but rather there is the communicated expectation that we receive with absolute certainty any positive results so that we can then embark on our routine contact tracing. With regard to the specifics of every situation, I will have to defer that, but tell you that we are still in the place where the following needs to be said to our general community. Yes, we are announcing today that we now have evidence of very likely community-based transmission, but it is not widespread, and we hope and believe that it is in the early phase of that process. What will occur at some point in the future is a little bit of a transition, and we are working towards a capacity to do a lot more regional testing in some innovative ways. The current mechanism that is in place for individuals who perhaps have symptoms, as we know, that may or may not be in any way related to COVID-19, are for them to have the initial contact with their medical personnel And then, if it's going to come to the public health laboratory, there is a process of interaction by which those decisions are made. Though Dr. Wooten mentioned we have an ample supply of those tests, we have to balance the stewardship of ensuring that they are available for who we consider to be greatest at risk, at the same time knowing that in the context of all of the public communications that there are probably a lot of people who have concerns. We still strongly believe that the vast majority of individuals who have congestion and mild symptoms, very, very low risk at this point that they have COVID-19. And so I know that was not a simple answer to a not so simple question, but we are balancing the stewardship of testing capacity with the appropriate access in the coming days, both through some unique innovations that we are pursuing, as well as increased capacity that is occurring. Some of that may change.
If I could just do a follow-up real quick. As you talked about innovative means, Denver started drive-through testing yesterday. You don't need insurance. It was free. You need a note from your doctor. And they tested 160 people yesterday drive-through. You can get an emailed note from your doctor.
Yes, sir.
If Denver can do it, why can't San Diego do it?
That is an excellent question. The question has to do with regard to some new innovative approaches that are happening in other parts of the country. Our chief nursing officer here in San Diego is already in contact with the officials in Denver. We are actually pursuing, I will quickly say, a four-pronged approach of looking at increasing the mobile capacity of testing to be in individuals' homes rather than even having to leave their home. We are looking and developing potentially within the next 24 hours a very similar drive-through capacity option here in San Diego. Some health systems on case-by-case bases have already done that. We are looking at the potential of some innovative destination sites, and we are in some exploration with other national entities about the potential of even doing home testing. I would call that the Uberization of COVID sampling. So all of those things are underway. Other questions? Yes, sir.
Andrew Bowen, KPBS. You talked about the capacity of testing. What about the capacity of the contact investigations? How many of those can you handle at one point, and are you anywhere near that point right now?
Let me restate the question, and that is a good one in terms of our capacity for doing the contact tracing and our routine epidemiological work. I will allow Dr. Wilma Wooten to respond to that question, sir.
Contact investigation is a lot of work. Currently, our staff are meeting the pace and the capacity, the need that we have. But we are looking at expanding or surging by bringing in contracted nurses as well as volunteers from some of our local healthcare systems in San Diego. So we are planning for surging up if the current capacity increases, and we anticipate that it will increase. I wanted to go back to the former question. We will not be able to test everyone. So I think that's very important for everyone to know. And once we have community-wide spread, if people are stable, they have symptoms that are similar to a cold or a mild flu, we will ask them to stay at home until their symptoms are resolved. So the testing is reserved for those who need it most. And the CDC categories included, we ask individuals if they've traveled to the COVID-infected areas. Have you had contact with someone who's a confirmed case? And the third category is the one that is challenging for physicians, and that's if they patient presents with respiratory distress syndrome, but they do not have a history of travel. They do not have a history of contact with someone who's confirmed. And in many cases where those individuals have been tested, they have been positive. So I think it's very important for everyone to know that everyone will not be tested.
Thank you, Dr. Wooten. Yes, ma'am.
MCAS Miramar just confirmed their first Marine infected with COVID-19. Can somebody give us more information on that person and his or her condition?
Yes, we actually have a representative from the Marine Air Station with us, but he is here to discuss any questions that some of you may have with regard to logistics. In terms of questions related to anything with individual cases, I would direct you to Captain Gregory from Marine Air Corps Reserve Base Station Miramar. Yes, sir.
Artie Ojeda from NBC7. A lot of parents are watching this news conference right now, and while they may fully understand the limitation on gatherings larger than 250 people, they're sending their children to school every day. So what is your message to parents, and also is there going to be some unified effort directed at every single school district to have a uniform plan and protocol in place?
As I initially respond to your question, I would like to invite Superintendent Martin to come to the microphone and provide me some air cover. I will say the following, and it's a quick medical clarification of what we have talked about. The fact that children from other parts of the world that we have learned from who get infected have very mild disease or potentially are asymptomatic, that is wonderful from the perspective of being concerned about their health and well-being, but they are still infectious. And many of them live with members of their family who fit into the categories that we have discussed. And so the county is not in the position of, at this point, giving any specific directives to either regional or specific districts, but you can rest assured that is an area of both high priority monitoring and vigilance that we are actively on top of. And with that, Superintendent, may I ask you to come and make a couple comments, please?
Thank you very much, Doctor. You're the one providing the air cover, actually, because I believe in a public health emergency, our best course of action is to seek the wisdom of the public health officials. As a superintendent of San Diego Unified School District, remember there are 43 districts, including the county office, and we're in close communication with Dr. Paul Gothold, the county superintendent, and Wilma Wooten and her team on a daily basis, hour by hour, to make sure that we're making wise decisions for the public health and safety of our students. So it's always in very close collaboration. I echo our mayor. It's important that we are all prepared and that we do not panic. Plans are in place, preparations are ready for us to be able to make decisions as necessary. The plans to support our most vulnerable students are ready. The plans around social distancing and to immediately limit gatherings or cancel all gatherings of 250 people or more were part of a city, and we are following that guidance. As I said again, all decisions are made in concert with the public health officials. We do not make decisions in isolation, and we cannot make decisions without the guidance and approval of the public health officials, and we appreciate the science and the words that you give us and the wisdom around these actions. Thank you.
Are senior proms gonna be canceled?
Last question. Go. One more.
I'll take it from here. Yes, sir.
Greg Moran from the Union Tribune.
Sure.
You mentioned that the point of a lot of this is really to flatten the curve out, not to overwhelm the healthcare, in particular the hospital system. What is the bed capacity, hospital bed capacity in San
Can I have
Diego
my
County?
red folder, please?
Are there plans to expand that in a worst-case scenario by either 10 hospitals or repurposing existing medical facilities?
Thank you so much, sir. Again, all of you asked thoughtful but very nuanced and appropriate but complicated questions. The question had to do with healthcare capacity. I would like to acknowledge and have Dimitrios stand up behind me so he can poke me if I say anything that is wrong. Dimitrios is the CEO of the Hospital Association of San Diego and Imperial County. Let me first make a few general comments and some things that I would think it would be good for the public to be aware of. Folks, we have been planning for this for decades. San Diego County has a very innovative, what we call all-hazard healthcare capacity plan. It has built into it data from multiple sources that we have available: ambulance traffic, emergency room traffic, epidemiological data, and there are certain data-driven triggers that give us the ability to know ahead of time if our system is stressed. We have deployed that in recent years with some of our more serious flu seasons, and it is also important, as you see the unity and harmony of your civic leaders, to know that through the Hospital Association there is intimate, multiple times daily communications at the highest executive level in order to coordinate and prepare for scenarios like this. To answer your specific question, the most recent data that I have is that we have nearly 4,200 beds in our region, hospital beds. That is a total count. Of course, there are breakdowns by a host of specialized beds and specialized rooms with specialized negative pressure ventilation and so forth. The important message is that part of what we are doing today is absolutely for the health and well-being of our entire community, but it is absolutely for the stewardship and the protection and the capacity of our regional healthcare system. I realize that many folks are fully aware of reports out of other parts of the world. Part of the intent that we have in being proactive and doing what we are doing today is indeed to flatten that epidemiological curve to allow us the capacity and the ability to be able to respond and provide care, especially care, to the most critically impacted individuals who could be infected by this virus. Dimitrios, would there be anything that you would like to add? Covered it. Thank you.
Wrap it up.
Include the military hospitals and
Okay, I think what we're gonna do at this point is if there's individual questions for any of the people behind me, they'll be more than happy to talk with you. Again, our purpose today is, again, to be transparent, to be straightforward with the public, to let them know what's going on, what the latest issues and concerns are, what the latest status is. This is a very serious situation, but at the same time, it is not a time for panic. It's a time for people to be ever vigilant and be aware of what's going on around them, and make sure that if they don't feel well, they stay home, they take the normal precautions, they wash their hands a lot, avoid handshaking and get used to fist bumps and elbow taps. But we are all in this together, and I think what we wanted to demonstrate today with the mayors and the representatives from the Navy, the business community, the healthcare professionals, is that we're all in this together, and we're gonna come through this in good shape. We just want the people and the citizens of San Diego County to be aware that they need to play a very critical role in this also. So with that, let me conclude the media availability, and if you have specific questions of individuals, you can take care of that now. Thank you. Good job.
Thank you.